Okay, so BSI scene safety. I am approaching the scene of a potential delivery of a child. Hello, my name is Caitlin. I'm going to be your EMT. Can you tell me what your name is?
Courtney?
Courtney. And what seems to be the reason that you've called us today, Courtney?
I think I'm gonna have my kid.
You're going to have a baby today. That's exciting.
Yeah.
Alright, Courtney, I've got a couple quick questions for you.
Okay.
Okay, so first, have you received any sort of prenatal care?
I take some vitamins.
Okay, but have you seen an OBGYN maybe?
Yeah, a little bit.
Okay.
A while ago.
You've seen your OBGYN though.
Yeah.
That's good. Okay. And has your OBGYN said anything about any sort of pregnancy complications at all?
No,
for
I
you or
think
the
we're
baby?
okay.
You're good. Okay, great. And have you developed any sort of diabetes or were you diabetic prior?
No.
Okay, good to know. And have you come into contact with any sort of medication? Did your doctor prescribe you anything? Have you taken anything over the counter?
Just the vitamins.
Just your vitamins. Okay.
I don't know if that counts.
Sure, just the vitamins.
Yeah.
Love that. And have you come into contact with any sort of wine, any illicit substances perhaps?
Nope. I've been very careful.
I'm glad that you've been careful. That's great to hear. Okay, Courtney. And have you had any sort of discharge? Did your water break? Anything like that?
Yeah.
Your water broke? Okay. Anything else? Any blood?
No, not that I know of.
Okay, sure. And how many pregnancies have you had, Courtney?
This is my first.
This is your first one.
Yeah.
Okay.
Yeah. I feel like I have to push though.
Okay, great. So now I'm gonna go ahead and look at my OB kit and make sure I have all the proper equipment. I'm gonna go ahead and place a sheet draped over my patient for some privacy.
Thanks.
Go ahead and spread your legs a little bit.
Oh.
Yeah, I know, Courtney. Gonna have a baby today.
Oh
That's so
my
nice.
god.
Okay. And Courtney, can you tell me how far apart your contractions are? It's
Like a couple minutes.
okay, like two
or
or
three.
Great. Okay, Courtney, now I'm gonna go ahead. I'm going to check for crowning. And it looks like we've got some crowning, so we're going to prepare for the birth of this baby.
Okay.
Now I'm gonna go ahead and I'm gonna wipe the mother's perineum with an aseptic wipe. And then I'm gonna go ahead and change my gloves to sterile gloves that come in the OB kit.
Okay.
Alright, so now I'm gonna go ahead and grab the baby by the head,
Oh my
avoiding
God.
the soft spots. I'm gonna place one hand on the mother's perineum and one hand on top of the baby to avoid an explosive delivery. Alright, so we have the head out. Now I'm gonna check for meconium staining.
But what?
There doesn't seem to be any meconium staining, so now I don't have to suction his mouth or his nose. I'm also gonna check for a nuchal cord around his neck. We're gonna go ahead and gently slide that off of him. Okay, now I'm gonna go ahead and apply downward pressure
Oh my gosh.
to deliver the upper arm. And then I'm gonna do the same thing and apply upward pressure to get the bottom arm. Now I'm going to hold the head and prepare for the delivery of the rest of the baby. And you have your baby.
Oh my god.
I know.
I can't see him. Is he okay?
He's doing great. Okay, so the time of birth is going to be, we'll say, 1456.
Oh my gosh, I have a Taurus.
You
Okay.
have the Taurus, yes. Okay, so now I'm going to keep the baby at the level of the mother's perineum. I'm going to clamp the umbilical cord 10 inches above the baby and then 3 inches below that. So 10 and 7 inches, and then I'll go ahead and wait till the umbilical cord stops pulsating and then I'll snip it. Now I'm going to go ahead and make my baby penguin burrito.
Oh my god, that was alive.
You still have to deliver the present.
Oh my god, what? No.
Okay, so now at the 1 minute interval, I'm going to go ahead and assess the APGAR score of this baby. And so he looks like he's pinkish in the middle, but his arms are a little bit cyanotic still, so we'll give him a 1 there. His pulse in his brachial arteries. His pulse is above 100. So we'll go ahead and give him a 2 for that. He is grimacing well, responding to all sorts of activity. So we'll give 2 for both of those categories. And then his respirations, he's breathing well. So I'll go ahead and give this baby a 9 on the APGAR score. All right, wrap him up. All right, congratulations, here's your baby.
Oh my god.
Go ahead and have some skin contact
Oh my
time with
gosh.
your baby. You want to breastfeed him, go ahead and do that too.
Buddy.
And now I'm gonna get ready for the delivery of the placenta.
Oh. It's just you and me, buddy. It's okay.
Yeah, so now the placenta has been delivered. I'm gonna go ahead and note the time of the placenta being delivered, so we'll say it's 1500 now. I'm checking the placenta, making sure everything's intact, and I'm gonna go ahead and put it in a bag and bring it with us to the hospital as well. And now I'm going to instruct the mother. I'm gonna put an obstetrical pad right in between your legs here. Go ahead and close your legs for me to hold it there.
Okay.
Yes, thank you. Okay. Now, if the mother was bleeding excessively, I would put her in our power position to treat her for shock. So that would be her laying supine. We would add some extra blankets to keep her nice and warm, add an on breather mask of oxygen at 15 liters, and we would rapidly transport her. Additionally, in order to encourage the uterus to contract and hopefully get all the excess blood out, then we can do a fundal massage. So I'm gonna go ahead and place my hand on your abdomen really fast. And I'm going to push down. It might be a little bit uncomfortable.
Okay. It hurts a little.
Yeah, it's probably a little uncomfortable. Okay. And that's another way in which we can get some excess blood outside of the mother. And then at this point, now we can alert the receiving hospital that we have our 2 patients, the mother and the newborn, arriving quickly to the hospital.